So if we're talking about inflammation, Casey went through you did a nice job in focusing in on the inflammation and some of the things that go on. So I try to simplify it too because it can be quite a complicated process. What is inflammation? What happens? Well, let's just use an example. First of all, as you spoke very clearly of that inflammation can be good and it can be bad. In the normal area, you have an inflammation and that enhances healing. And so that's really the purpose of inflammation. It's both healing and protection. So in protection in the sense that you have an area that maybe has an infection and you want to bring in those macrophages and those immune elements that are going to clean up the mess, or if that's damaged tissue, clean that out so that the full healing can occur. And then, but the process of inflammation is quite intriguing. So it's a little bit like getting a 911 call in that you send an ambulance out there, or do you send a fire truck, or do you send a policeman? Which is it? You don't really know until you sort of get there. So the inflammation is a signal to the body. It's the 911 call. Well, you need to go out and check that out. And so the body sends immune cells. The first step is it invites immune cells, or the immune cells are already there, and they start to signal back to the body, and they will stimulate and release these inflammatory substances in the area. And when that happens, then you have either you have the reaction that occurs that protects against the toxins, or you have the recruitment of other immune cells. And in that process, you have many of the other immune cells that are coming to the area, as well as some of those irritating substances called cytokines that are released into the area. And those are the ones that cause the redness and the swelling and the heat and the pain that go on. And now, the next process should be the healing process. And that pretty well works most of the time, but for a lot of us who are facing chronic diseases, then you can imagine that this 911 call is like a switch, a light switch. It gets turned on, but somebody forgot to turn it off. And so you have this continual inflammatory situation that is cycling and cycling, and it doesn't turn off. Well, how do you get that calmed down? You mentioned steroids. Yeah, they work, but as you said, they eventually cause further destruction and further damage. You can't keep up with that. And prolotherapy sounds like a great idea to involve for those chronic situations that are there, but not really. It may not be chronic inflammation, or in the sense that we see in terms of the destructive inflammation that we're typically seeing, but enough to cause significant amount of pain. So where does cannabidiol fit into there? And I think it actually fits into the inflammation story in a number of different ways. First off, when there is inflammation, the cannabidiol can go in and they can alleviate at least a portion of the pain. It'll provide some analgesia to the area. So big help. And then it starts interfering with the cytokines. The cytokines are those inflammatory substances that are causing a lot of the symptoms, whether it's pain or it's recruitment of the immune cells, or it's the swelling and increased permeability of the vessels that are around the area, or it's the redness, or it's actually the amount of recruitment of the inflammatory cells that are there. So you've got these macrophages that are on the site and they're coming in. Cannabidiol has actually been shown to reduce the number of those macrophages and those inflammatory cells that are populating the area, even to the point of reducing the number of antibodies that are being presented to the T cells for differentiation and creating antibodies in the inflammatory process that's going on. So a number of fascinating responses that are going on. On the same line, the CBD is going intracellularly to affect the communication within the cell, whether it's at the mitochondrial level or the endoplasmic reticulum, or it's at the nucleus. A lot of that communication is actually signaled by the cannabidiol and improves the functioning that goes on with it. And as a result, you have this global possibility of improvement in a number of inflammatory situations.